So they put me under for that. I lost my memory as of the operating room. I got up. I didn't get up suddenly for that. I got up very gradually. I was kind of woozy afterwards. And, however, I woke up with gauze all up in my mouth, all covered in blood. But I didn't have a dry mouth. I didn't have any kind of dry mouth or even nausea from the anesthesia. So I figured the anesthesiologist must have done a good job, or they just didn't use as strong of anesthesia for that for some reason. That procedure, it's just bad having surgery on your face, because you identify with the face so much and you use the mouth so much. So having pain there is just bad. I had to take painkillers for a full week. A week after that, still, it took to get rid of all the pain and the swelling. And I still have sockets that are fairly deep. I've been told those will go away within about a month. So that's, in short, my experiences with those procedures. I've also had to have a number of tests done leading up to those surgeries and now leading up to this surgery, mostly blood tests and things of that nature. My doctor, in doing the blood test for the wisdom teeth removal, he found that I had slightly elevated bilirubin, so I had to have more blood tests done to check for hepatitis and liver functioning, and I had to have an ultrasound of my liver, and those came up saying that I'm basically fine, I'm fit for surgery. But it's just more complications, I also decided to get a flu shot, just because I'm having the surgery around flu season, and my parents and my brother thought that it would be good to make sure I didn't get flu while in the hospital. So I described my experiences with those surgeries very briefly, just because I'm tired right now. I'd like to go on to describe my experiences leading up to this heart surgery. So I've met with my surgeon already twice now. The first time was, of course, just to meet him. The second time was because I first met him a few months back, and I wanted to ask some more questions. I didn't get to ask many questions the first time around, and just be more filled in on the whole process. So I've learned a lot through that about what what will be happening in this surgery. So the valve they'll be implanting is a porcine valve, I think made from the pericardium of a pig. It's the Edwards-Carpentier pulmonic valve. And unlike mechanical valves, it doesn't make any clicking. It doesn't require me to take Coumadin for the rest of my life, which is a major plus. Although you can't actually get a mechanical valve for the pulmonic spot position. For some reason, I'm not exactly sure why, they simply don't do that. It doesn't work well. I've been told that the procedure carries about a 1% chance of complication. Most of that is infection. There's a small chance, just due to the heart-lung machine mostly, of getting an embolism that could disable or kill me. But it's a very small chance. They're also going to reconstruct my right ventricular outflow tract with Gore-Tex to allow the valve to rest better. This hopefully will allow future valves to be implanted percutaneously. There's about a 50% chance that I will require a blood transfusion. And one thing that you can do if you're having surgery, if you know at least 2 months in advance, is donate your own blood. though I decided not to do this just because, for me in particular, donating blood is very difficult. Even just giving enough for a test, it's painful to me. I have little veins that contract even more when I'm nervous, and I just decided to avoid any complications of needing epigen or potentially having less blood at the time of my surgery. I've been told that the surgery will last between 3 and 4 hours, and hopefully they'll have the breathing tube removed when I come out. If they don't, that's apparently a bad sign. I expect to be in the hospital for between 5 and 7 days, though they said possibly I could even get out earlier if I'm doing well. They will have an access tube or IV in my neck, which should hopefully come out after 24 hours, and then they put an IV in the arm. They will also have a drainage tube in my chest, which will come out about 24 hours before or the day of my leaving the hospital. And they have decided to keep me in the intensive care, specifically the pediatric intensive care, because apparently that's the good one that all the doctors try to get their patients into, for my entire stay. And then I can just leave straight from there. I will apparently be getting some pretty heavy pain medication while I'm in the hospital. Afterwards, however, they said I may take Motrin for 7 to 10 days, and after that, just a baby aspirin to help with the heart, I guess, to help prevent a heart attack, maybe. Now, the main risk with this surgery, for me, is because I've already been operated. I have a lot of scar tissue. So, if they can get through that scar tissue and hook up my heart without anything bad happening, then I'm more or less in clear water. After my sternum heals, which will take about 2 months, the one thing that I will carry around with me for the rest of my life is sternal wires, which they don't use in babies because babies heal better, apparently. Imagine that. And that may show up in, say, airport security scans. It may make it more difficult to use MRI to view my heart. And so they said that they'll give me a card to carry around to explain it to people, particularly if I'm passing through metal detectors. But it doesn't really pose any danger to me. I can still go in an MRI, for example, without it ripping out of my chest. Kind of like the studs in your jeans, maybe. They just aren't attracted to the magnet. So that, I think, is where I'll leave off for now. Again, I apologize for the heavy editing and for maybe being a little too concise or simplistic about this. I'm just in kind of an awkward position right now. So maybe I'll talk a bit more about this stuff tomorrow. See you.